Hello, thank you for joining us for Building Strong Communities. I'm Erica Manny, the Chief Executive Officer for the American Red Cross Central Appalachia region. I hope this show will provide you with vital information to help keep you and your loved ones safe and help to build strong and resilient communities. The mission of the American Red Cross is to prevent and alleviate human suffering in the face of emergencies by mobilizing the power of volunteers and the generosity of donors. The Red Cross aspires to turn compassion into action so that all people affected by disaster across the country and around the world receive care, shelter, and hope. Our communities are ready and prepared for disasters. Everyone has access to safe, life-saving blood and blood products. All members of our armed services and their families find support and comfort whenever needed. And in an emergency, there are always trained individuals nearby, ready to use their Red Cross skills to save lives. Through this show, we'll provide you with critical life-saving information for you, your family, and your community. We have a very special guest today, Dr. Sherry Young. Dr. Young became the Secretary of West Virginia Department of Health at the beginning of this year. She previously served as the Associate Chief Medical Officer to the Vandalia Health Network and Executive Director and Health Officer of the Kanawha Charleston Health Department. Dr. Young received her Doctor of Osteopathic Medicine degree from the West Virginia School of Osteopathic Medicine, graduated summa cum laude from West Virginia University with a Bachelor of Science in Speech Pathology and Audiology and Master of Business Administration from Brandeis University in Boston. In today's episode, we will discuss with Dr. Young her new job, ways to improve your health, keep your loved ones safe, and explore the critical life-saving tools the Red Cross provides to our communities. Thank you so much for joining us, Dr. Young, and we're excited to have you.
Thank you so much. It's a pleasure to be here.
Well, I mentioned that you've taken on a new role this year, and congratulations in becoming our State Department of Health Secretary. So we're thrilled about that and wonder if you could tell us about the new structure, your role, and what you want to accomplish.
All right, thank you so much. So we've been very fortunate. At the beginning of 2024, the former DHHR has split into 3 separate departments. That began with Governor Justice signing into law House Bill 2006. And what that's allowed us to do is to focus on more patient-centered and public-facing services that we can get out to West Virginia citizens. So my piece will be over the Department of Health, and that houses public health responses, Center for Threat Preparedness, things that we saw not only during the pandemic, but things that services that we render to help keep West Virginians safe. And I have 2 others, great secretaries that I work alongside from the former departments that are over Department of Human Services and Department of Health Facilities, but we are hard at work with great individuals to help serve our state.
Well, it is clear that you are so passionate about people's health as well as the health of our communities. I wonder if you might be able to tell us what people could do to improve their own health.
Absolutely. So the first thing you can do to improve your own health is to get a healthcare provider. Find a nurse practitioner, find a family physician, someone that can help get you on the right track. Prevention, the old adage, prevention is worth an ounce of prevention worth a pound of cure. That is a wonderful way to think about your health because it's an investment into the future. One of the things that I want to work on with the Department of Health is getting better cancer screenings out to our folks, addressing issues such as hypertension, diabetes, and making sure that patients are taken care of from the entire spectrum, not just at a doctor's appointment, but that they have all the things that they need to be healthy, including access to transportation, access to healthier foods, making sure that individuals are taken care of on a community level.
Well, we saw you take a front and center role on people's health at a community level during the pandemic. And I wonder if you can tell us what you learned from that experience.
I have been so blessed. I have worked with some of the best teams in the entire United States, and I think that came to light during the pandemic. And I'm so thankful the American Red Cross was there with us. But between our county governments, our state governments, our EMS community, fire departments, and health departments, which typically don't even intersect, we all came together to make sure that the communities were taken care of. So the biggest thing I learned from that experience is community matters. Use your resources wisely and be prepared for the next thing that could be coming. Making those relationships and collaborations early makes it so much easier to stand up in the times that you need them.
Well, we are such a big, broad community across the whole state of West Virginia.
Yes.
And in your role now, I wonder, what is it that you can tell us that, we can be doing as a state to improve our health?
As a state, we need to come together and realize that we need to be pushing in the same direction, meaning that we need to find things that work for everyone, but realizing that not every community is the same. So we even learned during the pandemic, another important lesson, even with having huge clinics and huge drive-throughs for testing and vaccinations, you still had to get down to that individual level, whether it was going into individual houses and taking care of people where they are. So be a good community partner. That would be the thing that I hope that West Virginia carries forward.
Do you have a few specific strategies that you might like to share with us?
Absolutely. I want to build the partnerships moving forward that I'm not going to be secretary forever, but I want to leave it to set the next person up for success. I want to make sure that we are looking at everything from the top leadership all the way down through the bureaus, all the way to the employees who are the direct service providers for our communities. I want to make sure that we have those needs met and that we can sustain these systems for years, decades to come.
Thank you for being such a strong supporter of, community health, and you've been a strong supporter of the American Red Cross in our communities as well, and we're thrilled about that. And we would love for you to share some of your experiences and expertise and why you think the Red Cross is so vital.
Absolutely. The American Red Cross has wonderful programs. So I'm going to break it down. I do have some very personal experiences that I want to share. But first of all, from a healthcare provider standpoint, the importance of blood donation. And one of the things, I am a blood donor myself. One of the things that I've loved so much, having this wonderful app where I can go in and make my appointments, answer my questions early. It has been so wonderful to be on that side of it. So I feel like I'm contributing to the American Red Cross. We have individuals in the state every day. We have traumas. We have folks who need immunoglobulin. We have folks who need blood products for several different diseases, that it is a life-sustaining treatment, and it is so important. So I hope that I can help support that, and especially for your efforts for blood donations as well. Well,
thank you for being a life-saving blood donor and for inspiring others to get our free app and, donate blood and set up their appointments, even find out where their blood is going to help.
That is the interesting part. You can follow your blood through its entire journey to see where it ends up and where the impact is being made, that you're sending your life-saving treatment. And it is so to kind of help folks out. It can be a little bit intimidating, but if you can get routine blood work and you can tolerate it, it is. You always have the best professionals there to help get you through the process and to make it seamless and to make it as easy, both physically, mentally, emotionally, and very supportive groups. I've never had a bad blood donation yet.
Well, thank you for saying that. And it is so important because someone in this country needs blood every 2 seconds.
Absolutely.
And what an amazing statistic, really. And you've seen the impact of blood as a physician. And so I wonder if you might be willing to elaborate more.
Absolutely. So there's so many aspects to giving blood products or whole blood or red blood cells. There's a very important initiative in Cabell County right now that we're hoping will go statewide at some point, but the Cabell County EMS is working with folks to give whole blood in the field. When you have a trauma and you have trying to describe with a trauma that you may be losing blood very quickly, it is life-sustaining to put back that blood product to keep the heart, the lungs, to keep your organs stable until you can get to a treatment facility to get more advanced treatments such as surgeries or things if that would need to be the case. So the faster that we can get those blood products to folks in EMS, the better off we're going to be, and the more of a chance that people will have at a full recovery. So it is life-altering, life-sustaining treatment that I've seen, unfortunately, a lot in my medical career. But we have the ability to advance that, but we need that blood product to help folks out.
Well, I am grateful that you bring that up, because over the last 20 years, we've actually seen about a 40% decline in blood donations. And that is, extremely concerning, given that we know only about 3% of Americans donate blood. So hearing about additional, opportunities to give and ways to, make that available is really exciting. And I know you have been very committed to that. You've mentioned this a couple of times already, that you yourself are also a blood donor. Mm-hmm. And I just wonder if you can talk to us a little bit more about your experience as a blood donor.
The experience as a blood donor has been wonderful. You can fill out your questions on the app. If you're not an app person or an iPhone person, smartphone person, you can go in person and they will walk you through the process. But everybody has been wonderful from start to finish, getting you through the line. If you fill out everything beforehand on the app, you can be in and out in under 30 minutes. So you can do this on your lunch break. It's very accessible. If you're scared to donate blood, if you get blood work, it is not any different than that. It is very, very easy. And I know sometimes we build things up in our heads, but think about the end product. Think about the fact that you are saving somebody's child, that you are saving somebody's life, and you never know when you're going to be on the receiving end of needing that product. So you have no idea how many people you can help just through one blood donation. At least give it a try.
You mentioned people get nervous, and I think one of the things that motivates me when I start to feel a little nervous is I go to redcrossblood.org and I look at the stories that are online.
Yes.
And you're so inspired when you said, think about the person who is receiving it and the lives that you can be saving, because you can save more than one life with one blood donation.
That's right. And to be able to put a face with that really brings home the impact that you are making. And literally, that puts you in the hero seat. You are a hero because you are saving lives.
Absolutely. And, blood donors can give about every 56 days. Mm-hmm. And so you can do this, just about 6 times a year.
That's
and
right.
They save more than one life every time a blood donor goes in to donate. I wonder if you can tell us why regular donations are just so critical.
Regular donations are very critical because of the impact that it has, whether it is for surgery, for people who are undergoing chemotherapy or need other blood products, the plasma that is used, to help people defend their immune systems. There are so many things that your blood product does to help save other people that you truly are a hero by making that donation.
Well, at the Red Cross, we have many ways that people can help. And, as we focus on some of the ways in healthcare that people help, we also encourage people to take a CPR, first aid, or AED training class. Yes. And I wonder if you can just talk to us a little bit about the importance of that in our communities.
Yes. So just like talking about having blood products on scene, the faster you can respond to somebody who is in need, and that is whether it is a cardiopulmonary failure, whether somebody has dropped, they need CPR, being able to make those assessments quicker and provide treatment more quickly, you're going to save lives. It is critical time. So if you think about the fact if somebody would go into cardiac arrest, if nobody is there, you have about 7 minutes before the brain starts deteriorating from that lack of blood or that lack of oxygen within the bloodstream, because you're not circulating. The faster somebody can get there to issue CPR or can assist them with an AED, the better recovery they're going to make, the less long-term side effects that they'll have, and the more chance of giving them a recovery. I'm so proud of the fact that they teach CPR in our schools now. That's definitely a win. It is very easy. While it looks kind of intimidating on TV, it is something that anybody can learn to do and be there at the ready, and another opportunity for folks to become heroes.
Well, thank you for mentioning that, and we certainly are thrilled that our schools have, adopted the requirements of, the CPR knowledge, and, we have full-fledged classes for first aid, CPR, AED, and more, and we even, for organizations and partners, often offer hands-only CPR training, which is a really brief, opportunity. So it really does make such a difference when you talk about the amount of time it takes for your brain to be impacted without that flow of blood. Thank you.
Absolutely.
Well, we'll be back with Building Strong Communities after this quick break. Please stay tuned.
Before your donation, please make sure to eat a healthy meal and drink plenty of water. If you're feeling nervous, please express that to the Red Cross staff. They will calm you down and walk you through the entire process. When you come in, you can listen to music on your headphones or watch something on your phone. This will help take your mind off the process and get you through your donation. You can even bring a friend or family member with you to donate. Close your eyes, breathe slow, and think about something happy, like the life that could be impacted by your donation. Take your time after the donation to eat a snack, drink some water, and know that this small amount of time can make a lasting impact on someone else.
Welcome back. We're talking to Dr. Sherry Young today, the new Secretary of the Department of Health. Dr. Young, thanks again for being with us and talking about all of your Red Cross experience.
Yes, some of it professional, some of it deeply personal.
Well, speaking of, I know that you're well aware the Red Cross responds to a disaster every 8 minutes, and our volunteers are always ready to help those who are in need. You have been very open about your own disaster experience and your experience with the Red Cross. Can you share?
Yes. So on January 12th of 2018, my family experienced an explosion at our home. It's not something anybody plans for. It's not something anybody would even care to anticipate. Prior to that, it's a nightmare situation. It's something that nobody wants to think about, but it's something that we should probably all be planning for, just for the worst case scenarios. So the involvement there, we woke up and smelled propane and was able to get out of our house thanks to 911 and our first responders. We were out of our house about 5 minutes before it exploded, and it was a catastrophic event. We lost everything. And at that moment, one, you learn your priorities. You know that family is first. You do the self-check. You looked at my daughter, counting fingers and toes and making sure she's okay. And you have to take that next step. And it's a very intimidating moment to just watch everything in front of you, everything that you own, everything that you've built, gone literally within seconds. We have heroes all over the place. Our first responders are heroes. I'm so grateful that nobody got hurt that night. That was definitely a potential. But among those heroes, and I don't think that American Red Cross gets enough credit for this, that responding to individual disasters. We've seen the grand things that you guys have done for floods and disasters and hurricanes, but that night, American Red Cross and the volunteers came to my neighbor's home, and it was very meaningful. So everything from one of the volunteers sitting down with my daughter talking about her her pets and her feelings and everything, sitting on the couch, being with her, while I could answer questions and try to figure out our next moves, and working with, the fire department, and having somebody there to help be a mom in that moment. And there's so many other layers. They came, they offered us food, they fed the firefighters. I mean, and this happened at 1:30 in the morning. This didn't happen at 4:30 in the afternoon and everybody gets to go home. These people were out in the middle of the night serving others and making sure that everyone was okay. And I will tell you, that was the first thing we received too, was from the Red Cross. You don't think about how important a toothbrush is, or toothpaste, or those things that we take for granted every day until you don't have any of those things. So Red Cross very quickly helped give us things to get us through the next days, and to get us back on our feet in the worst hour of our need.
Well, thank you, number one, for sharing a very personal experience and making viewers aware of how important it is to be prepared. And you mentioned that the volunteers at the Red Cross were so impactful to you and your family. Yes. I wonder if you might, have something to share with the viewers about, spending their time becoming a volunteer.
The volunteers for the Red Cross have been amazing, and if you truly want to be part of that process and be a hero, it is a wonderful thing to give back to a family in their worst hour. The tasks are not small. You are facing people in some of the most devastating times of their lives, and they appreciate, I cannot tell you how much we appreciate it, and I know that other families who've been through similar things before appreciate that help. So if you have the time and the ability to volunteer your time, to give back, this is a wonderful opportunity to help your fellow West Virginians.
Well, you have been an amazing partner and promoter of making sure that people are indeed prepared, and educating youth to make sure that they're prepared. Can you talk to us about why that's so important?
Well, we always need to be prepared. We don't know what the next disaster is going to be. It could be personal. It could be something that affects all of us. So, having gone through the personal issues myself, having taught that to my daughter, and being an advocate to work with organizations like the American Red Cross, where you're prepared for the worst. You hope it never happens, but you have that ability. We're raising a generation of folks that are going to have to respond to more and more things moving forward. And so COVID taught us that as well. We didn't know what that disaster was going to bring when it first came on. So having that adaptability, teaching our youth to be adaptable. Think about the younger generations now that I look at my daughter, who's been through a very devastating event herself, and then she and her friends going through a pandemic and trying to navigate going to school, and the world changing in front of them. But that's what we're here for. That is training our next generation for that resilience and to keep moving on.
Well, anytime there is, an issue that has been faced, you clearly, step forward and, turn it into an opportunity to help others and to, teach others. And we mentioned preparedness. One of the things that you did to make sure that people are more prepared, particularly children, you wrote a book. Can you tell us about that?
Yes. Well, my daughter and I, that's one of the resiliency things that we talked about in recovering from what happened with our house. We found one of the animals, a little cat. She was a little black cat named Lucky, ironically, that we found. Really, it was a couple of weeks later. We didn't think any of the animals, unfortunately, had survived. But she came out from the wreckage one day, and we were able to coax her back in. She still lives with us at our new house. But my daughter and I turned that into an experience of hope. So, she illustrated it. She's a much better artist than I am, I will say that. But we wrote the book about a princess losing her kingdom and then having to go to another kingdom and being able to experience that and have her cat. And so a truly based story on a tragedy, but trying to find the good in everything.
Well, that cat was appropriately named for sure, and the book was such a wonderful way for children to learn about fire and preparedness. And, we know that children that are school-aged are often the ones who take preparedness information home to their families.
Yes, and I will say this, when our home had, one of the things that had truly saved our lives, because nobody prepares for a gas leak or, a propane tank to happen, like what happened in our circumstance. And, walking around the house, the reason that we went to where we were, which was just enough space, 80 yards away behind some trees, that was our designated spot for if we had a fire and the fire trucks were coming to keep her out of the way. So having that preparedness, even if it's not quite what you planned for, can help save your life in the worst of circumstances.
You have just hit such an important point that we like to make when we're doing preparedness education, and that is making sure that you have a meeting spot, your family knows where it is when there is an emergency at your house, that you get away from your house, but it's close enough that everyone can get to it, and make sure you all know that everyone is safe, so no one, God forbid, would go back looking for a family member when they're already safely out of the dangerous situation.
Exactly. And so knowing that meeting point, being able to know that everyone's safe, I will tell you from experience too, whatever you have in that house, even if it can't be replaced, people cannot be replaced. It's the hardest thing to have to do, to leave things behind. Even if you know you're in the worst of circumstances, go to that meeting point, have your plan, and save your family's lives.
Absolutely. Thank you for sharing those great tips with us, for your very personal story, and I know it will inspire viewers to be more prepared for all kinds of disaster. And the Red Cross is involved with, 5 different lines of service, and you've mentioned several of them already today. You shared with me that your family has yet another connection to the American Red Cross. Can you share that information?
Absolutely. It's amazing how many places we've intersected, but these are very important and very trying times. So my grandmother had died when my father was deployed overseas, and the American Red Cross was instrumental in finding him, notifying him, and getting him home. So I will say wholeheartedly, as a professional and from a very personal place, the American Red Cross is vital to everything that we do. In any way that you can contribute, whether it's learning CPR, donating blood, a financial contribution, volunteering, you are truly helping heroes. And so thank you for all that you do.
Dr. Young, you have said it so perfectly. We love to tell people that there's something for everyone to get involved with at the American Red Cross. And I often say, please consider giving us blood, money, or time, because we can put it all to good use in making sure that our communities are stronger. And with all that you do to make our communities stronger, I am grateful that you have joined us today.
Thank you. Thank you for having me.
Absolutely. And with that, we are so lucky to have Dr. Young as the Secretary of our Department of Health, and can't wait to see what is next. So viewers, we hope you enjoyed this episode of Building Strong Communities. Thank you so much for watching. Contact your local Red Cross or the number on the screen. Visit our website or follow us on social media to learn more about the services the Red Cross provides in your community.